Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. Let me start by introducing myself. My name is Jessica Nanda Lelita binti Abdullah and my metric ID is BPT12230003. We are from Bachelor of Science in Pharmaceutical Technology intake December 2023. For this MPU3222 Critical and Creative Thinking, we are required to make a group video presentation about creative invention evolution. We are going to divide our presentation into 7 parts. Our topic for this group assignment is related to our field. It is NSAID drug. Have you ever heard about NSAID before this? NSAID stands for non-steroidal anti-inflammation drug, and that means this type of drug does not include steroid. NSAIDs are a class of medication commonly and widely used to relieve pain, reduce inflammation, and bring down a high temperature. There are nearly 2 dozen different NSAIDs available, but they are all work in the same way, and that is by blocking a specific group of enzyme called cyclooxygenase enzyme or COX. These enzymes are responsible for the production of prostaglandin. Prostaglandin are a group of compounds with hormone-like effect that control many different processes such as inflammation, blood flow, and formation of blood clot. Prostaglandins are a family of chemicals that are produced by the cells of the body and have several important functions. They promote inflammation that is necessary for healing, but also result in pain and fever, support the blood clotting function of platelet, and protect the lining of the stomach from damaging effects of acid. Prostaglandins are produced within the body cell by the enzyme cyclooxygenase COX. There are 2 COX enzymes, COX1 and COX2. Both enzymes produce prostaglandin that promote inflammation, pain, and fever. However, only COX1 produces prostaglandin that support platelets and protect the stomach. Non-steroid anti-inflammatory drugs block the COX enzyme and reduce prostaglandin throughout the body. As a consequence, ongoing inflammation, pain, and fever reduce. Since the prostaglandin that protect the stomach and support blood clotting also are reduced, NSAIDs can cause ulcer in the stomach and promote bleeding. Aspirin, acetylsalicylic acid, was developed in 1897 in an attempt to improve palatability. Indomethacin and ibuprofen were among the first non-aspirin NSAIDs to be introduced in 1964 and 1969.
Assalamualaikum warahmatullahi wabarakatuh and good morning. My name is Nur Mafaza binti Mama Amin and my metric number is BPT12230005. Next, I will explain about the uses of non-steroidal anti-inflammatory drugs, which is also known as NSAIDs. NSAIDs can be used to treat a variety of conditions, including pain relief. NSAIDs are commonly used to alleviate pain from conditions such as headaches, muscle aches, dental pain, and menstrual cramps. It is also used as inflammation reductions. They are effective in reducing inflammation caused by conditions such as arthritis and gout. NSAIDs are also used for fever reductions. It can help lower the fever by reducing the production of prostaglandins, which are involved in the body's response to fever. NSAIDs also have anticoagulant effect. Some NSAIDs, such as aspirin, have anticoagulant properties, meaning they can help prevent blood clot formation. Low-dose aspirin is often prescribed to reduce the risk of heart attack and stroke in individuals at high risk for cardiovascular event. NSAID is also used for post-surgical pain management. NSAIDs are often used to manage post-operative pain and inflammation following surgical procedures, providing an alternative to opioid pain medication. In some cases, it is also used in musculoskeletal injuries. NSAIDs can be used to help manage pain and inflammation associated with musculoskeletal injuries such as sprain, strains, and sport-related injuries.
Hello guys, my name is Muhammad Nufikri bin Aziz Zainul Muhammad. My matrix number is BPT12230006. Now I will talk about my part, which is example of NSAID. So the example that I choose is ibuprofen 200 mg, which is quartet tablet, and the second one is tramadol 50 mg, which is prolonged release tablet. The third one is diclofenac sodium 75 mg per 3 ml, which is injection, and the last one is ketorolac tromethamine 60 mg for injection. So that's all from me. Thank you.
Hello, my name is Vinutini Sami. My matrix number is BPT12230008. Today I want to present about the different types of dosage forms that are in non-steroidal anti-inflammatory drugs. So there are 4 types of dosage forms. The basic one such as solid, liquid, gas, and semi-solid. Non-steroidal anti-inflammatory drugs are divided into few dosage forms such as solid, liquid, semi-solid, and gaseous dosage form. Solid dosage forms means nature in which contains one or more drugs for therapeutic effects and excipients. The examples of solid dosage form drugs in NSAIDs are aspirin, Nufen, and naproxen. The second one is liquid dosage forms, which is the aqueous solution of the medicaments are used to induce the therapeutic effects internally and externally. Forms are less stable compared to the solid dosage form. Semi-solid dosage form is a medicament that is neither solid or even liquid. They are somewhere in between two states. The example of semi-solid dosage forms are gel, transdermal patch, cream, and ointment. Each dosage forms in non-steroidal anti-inflammatory drugs have its own advantage and disadvantages. It also can be suitable for certain patients and not suitable for some another groups of patients. It is used according to the suitability for each of them.
Hi, my name is Mohammed Shahrizad bin Bakar, and my matric number is BPT12230002. Let's explore the various routes of administration for NSAID drugs. The most common route is oral administration, which includes tablets, capsules, and liquids. Oral NSAIDs are convenient and widely used for their systemic effects. Another route is topical application. NSAID gels, creams, and patches can be directly applied to the skin over the affected area, providing localized relief from pain and inflammation. In some cases, healthcare professionals may administer NSAIDs through intravenous or intramuscular injections. These routes are often used in acute care settings for rapid pain relief. It's important to note that the choice of administration route depends on various factors, including the patient's condition, the required onset of action, and the desired therapeutic effects. Understanding the route of administration for NSAID drugs is crucial for optimizing their efficacy while minimizing potential side effects. Thank you.
My name is Nura Elis Natasha binti Muhammad Hardi Effendi, matrix number BPT12230004. Next, I would like to address a crucial aspect of over-the-counter pain relief, which is the side effects of non-steroidal anti-inflammatory drugs or NSAIDs. NSAIDs like ibuprofen or aspirin have pain and swelling, but here's the catch: they can cause some problems. Stuff like tummy aches, ulcers, and bleeding in the stomach can happen, so it is smart to be careful. Besides that, NSAIDs may also be bad for your kidneys. Using them a lot might make your kidneys hold onto too much water and mess with your blood pressure, especially if your kidneys are not in tip-top shape already. And guess what? Your heart might have a say in this too. Some studies say using NSAIDs for a long time could increase your chances of heart attacks and stroke, especially if your heart isn't feeling well. In a nutshell, while this painkiller can be helpful, it's like handing a delicate receipt. So, talk to your heart professional, follow the dosing rules, and keep an eye out for any tummy troubles or weird feelings.
Assalamualaikum and hi, my name is Nur Izzah binti Rosli and my matric number is BPT12230001 and I'm from Bachelor of Pharmaceutical Technology. In this video, I would like to talk about the contraindication of NSAIDs. So, who should avoid taking NSAIDs? The first one, to those people who has stomach ulcer. It can cause mucosal injury in upper, medium, and lower gastrointestinal tract, resulting in bleeding. Second, patients who have liver disease cannot take NSAIDs because NSAIDs induce liver injury, which might potentially lead to a fatal or it may need a liver transplantation. Next, for Crohn's disease, it can cause inflammation and worsen bleeding in the small intestine, but it can cause a flare if you already have the conditions. Lastly, patients who have asthma. Well, basically it can induce bronchospasm, and in rare cases, this reaction can lead to death. So that's all from me. Thank you. In a nutshell, we believe that these NSAIDs will evolve in the future. The future evolutions of NSAIDs is likely to involve advancements in several areas. The first one, safety and efficacy. Researchers and pharmaceutical companies will continue to focus on developing NSAIDs with improved safety profiles and enhanced efficacy. This may involve finding ways to minimize the risk of side effects such as gastrointestinal bleeding and cardiovascular complications. The second one is alternative treatment. As the field of medicines continue to evolve, alternative treatment options for pain and inflammation may gain more prominence. This could include the use of non-pharmacological approaches such as physical therapy, acupuncture, or herbal remedies. However, NSAIDs are likely to remain an important part of the treatment arsenal due to their proven effectiveness. Overall, the future evolution of NSAIDs will likely involve a combination of improved safety and the continued exploration of alternative treatment options. These advancements aim to provide more effective and personalized pain and inflammation management strategies for individuals. So that's all from us. Thank you.